Hi everyone, so my name is Shaina Patel and I'm studying neurosurgery this year for my topic for ISM. So before I go ahead and get started, I'm going to do an interactive activity with y'all. So one thing that I've learned a lot in my time at Parkland with my mentorship is that neurosurgery is not a single effort, it's a team effort. You have to, be a part of a team, get different opinions on things, and it takes a lot more than one person to do these kinds of things. So, okay, what you guys are going to do is you guys are going to try to figure out what this is and how to treat it with your team. And whoever wins will win this bag of Kit Kats, the whole bag. So you can ask me questions about this patient's symptoms, causes, what would happen if she's not treated. You guys can use your resources also, so you can use your phones, computers, whatever. The first group to tell me what this is and how to treat it will win the prize. Just a little background information. This is an MRI, I believe. You need to discuss it with your group, Travis. Okay, listen. So this is a scan. This is what you're looking at right here, these two sections here. And then this is an angiogram. Where's the laser pointer? Where'd it go? Okay. It basically shows the blood vessels in the brain. So it's pointing to this area, this part of this blood vessel, this part of this blood vessel. Just pretend like it's all the same one.
How specific? What the front, where the eyes are, where the side?
Doesn't matter. Just tell me what it is. Discuss with your group. Did you use your resources?
Yeah.
You have to tell me what it is and how to treat it. You guys have computers. No, use your resources. I don't know, discuss with your group.
We are discussing. What?
You have to form a final consensus and then I'll call on you. Yes. Alright, I'm going to help y'all out a little bit. These blood vessels, they're full of blood obviously, but there's more blood in the area where it's pointing to.
What'd you say that thing's called? Or the picture? What is that picture called?
It's an angiogram.
Are they gonna use? It's an angiogram. Oh, is it a? Let's use an anticoagulant drug. Okay, that's what we're saying. Shaina, we got it.
Wait, we have to know how to treat it.
I got it.
No.
You can use anticoagulant drug. Oh, no.
Final consensus? What about you guys? Final consensus? Okay, hold on. Wait, does everyone have their final consensus?
Yes.
Yes? You guys? Yes?
You say what it is.
Alright, we're going to go around the room like this and share. So you guys go first.
Okay, so we think it's an aneurysm and...
Oh, you can treat using anticoagulant drugs, and then you monitor it with an MRI scan. And if there's severe, you can do surgery in which catheter is inserted to break down and remove the clot.
Okay. Okay. You guys?
We also think it's an aneurysm. You're weird.
Okay. Treatment option?
I think anticoagulants first. Depending on the severity, I guess. If it's already at the point it's about to cause their brain damage, go into surgery all the time.
What would they do in surgery?
They would go in and remove the clot, I guess.
Do you know how they would do that?
I'm trying to just use my own brain. It's a surgery clipping.
Okay. You guys?
Yeah, we didn't get to answer. We just thought it was a normal clot that you can use blood thinners on, or I guess you can
Okay. And you guys?
I think it's arteriovenous malformation.
Okay. Treatment option?
It doesn't say the treatment option, but it says that it causes changes in eyesight.
Okay. Just take a guess. How would you treat it? Based on what it is.
Removal.
Well, no. So it kind of looks like it destroys the brain. So you kind of have to go in and fix it up.
Okay, so it's not a clot, it's not an AVM, but you guys are both right, it is an aneurysm.
Yeah, good job.
So an aneurysm, for those of you that don't know, is basically when you have a blood vessel in your brain, or they can appear in different places in your body too, but basically this little balloon sort of forms on one blood vessel and a bunch of blood collects there. So if it were to rupture, like all the blood from your brain would just rush out instantly, you would die in like a few seconds. So there are several treatment options. You can start with anticoagulants and see if that works, but a lot of times their go-to method is clipping or coiling. So I've seen 2 aneurysm clippings. What they do is they take this little tiny clip, that's what it looks like, that and that. They have different kinds. And they go and they clip right under the aneurysm on the neck of it. That way, if it were to rupture, nothing from over here would come out, you know? So since you guys were both right, you guys are going to split the prizes. So you guys take half, pass it to them.
I'll organize the splitting.
All right, so good job, you guys. This just kind of goes to show how you need a team to come to a consensus. You guys need resources, you need background information. Also, another thing you have to look at is you guys have to look at every single factor. So I noticed that a lot of you guys didn't ask about the patient's symptoms or causes, so that's something that you guys need to be asking if you were to come across a case like this. So a little bit about me. I'm 17 years old. I'm a senior at Frisco High School. I have a mom, a dad, and a brother. That's us in Australia. I'm holding a koala. I've had medical ambitions since I was like 5 years old, probably. I've always just loved what doctors do. I love how they interact with patients and how they help people. I love everything about the field. So in school, I kind of directed my path towards going on the medical route. We have amazing programs here in Frisco. Specifically, health science is one of our best programs. So I started out with medical terminology, and then I went to health science 1, where I got CPR and first aid certified, and then on to health science 2, where I became a certified nurse aide. I got to do clinical rotations at nursing homes and hospitals, and I got to ride in ambulances at fire departments for emergencies. And all this clinical work really opened my eyes to, not just what doctors do, but what nurses do, and technicians and nurse aides, and everyone that's behind the scenes. They do so much work. So I think it was good for me to see, a different side of medicine that I hadn't thought about before, because it really makes me appreciate everyone that contributes to making a patient get better. So I've been in these amazing programs, and this year I'm in Health Science 3, which is the next step in the program, where I continue with my clinical rotations at different hospitals, and I get to become an EKG tech, and I'll be a pharmacy technician through my pharmacology class. So I've really done a lot to kind of get involved in the field. And on top of all this, I'm in this class, ISM, which I was in last year also. So last year I was shadowing a general pediatric surgeon. This year I'm shadowing a neurosurgery, and it's taught me so much more than I would have learned just sitting in a classroom reading a book. So you can't learn everything by reading a book. You just have to go out there and do it sometimes. Obviously I can't do brain surgery, but I can watch. Another thing, I'm really active in school clubs, especially HOSA, which stands for Health Occupation Students of America. I've been president for 2 years, and it's basically a club where kids that want to go into the medical field will join. They'll try to, volunteer, and we'll get guest speakers to come and talk, and we do different events and stuff like that. It's a whole lot of fun. I'm in student council and some other stuff too. And then also, I'm involved with fundraising for a nonprofit organization called Heart Gift that centers around bringing over kids from third world countries to the U.S. to have heart surgery. I chose to do ISM last year originally because I wanted to get out of my comfort zone. I wanted to get involved in the field in a way that I couldn't get involved any other way. I didn't really know what I wanted to do going into it, but I really liked anatomy and physiology, which I took sophomore year. So I thought surgery was the route to go for me because, I feel like it's the most interactive with anatomy and physiology, and it was just so interesting. So last year I interviewed a bunch of different types of surgeons, and I chose Dr. Robert Minquez as my mentor, who is a general pediatric surgeon at Children's. That's him and me right there, and that's Children's in Plano where I was last year. And then this year I've taken a bit of a different route. I felt like with general pediatric surgery, by the end of my mentorship, I understood everything about it as much as I could at this age at least, and I just felt like it wasn't stimulating me anymore, and I kind of wanted to go to a field where I didn't know anything about so I could learn new things. And I had interviewed this neurosurgeon named Dr. Kim Rickert, and I remember I didn't want to interview her at first because she was all the way down in Dallas, and my teacher, Coach Goff, was like, no, just go and do it, just go and talk to her one time and tell me what you think. So I went down and I talked to her, and it was the most amazing interview I've ever had in my entire life. She was so inspirational. She told me her story of how she had a kid in high school, and then she finished high school and she went to college and she wanted to become a teacher while raising her kid, teaching biology, and then she ended up working in a neurology lab, and that kind of sparked her interest for neuroscience. And then she went to med school and got a PhD and did a residency and a fellowship, and then she became the chief neurosurgeon at Parkland Hospital. So an underdog story like that really motivated me, especially because she's a woman in the field, and she's one of the best people on the team. Unfortunately, I started with her, but she actually ended up moving to Pennsylvania because her brother got a malignant brain tumor, which is kind of ironic because she's a brain surgeon, but it's really sad. But she was kind enough to hook me up with my current mentor. So my quote for this year is, if you can't stop thinking about it, don't stop working for it. And that's really stuck with me because ever since the first time I saw brain surgery, I just couldn't get it off my mind. It's just been something that I'm so interested in, so I really want to pursue it further. My mission statement this year is to pursue the field of neurosurgery, and I want to make a product that shows what I've been learning. And I want to not just observe surgeries, but I want to observe every aspect of the field, like seeing consults and seeing patients in clinic and going to conferences and stuff like that. So one thing that we do here in ISM at the beginning of the year is we have a business symposium, which is basically a giant get-together for a bunch of ISM kids. So we have a bunch of professionals come in and we kind of do mock interviews with them to sort of get ready for our real interviews. And you just kind of get paired up with a random person that's in a completely different field than you are, but you really learn a lot by talking to these people. I was never interested in medical administration or electricity companies, but the things that these people told me were actually really interesting. And we had a panel of business professionals telling us about, what they think of students coming into the field and what they look for in interviews and stuff like that, and about their jobs, so I thought that was really interesting. So my route in ISM has been quite different from everyone else. The traditional path is that you come into ISM with your topic in mind, and then you reach out to professionals and you contact them and you ask for an informational interview. You go and meet them, talk to them, and then after you're done with your interviews, you choose someone to be your mentor. But I took a much different route. Since I had interviewed Dr. Rickert last year, I knew that I wanted to do neurosurgery this year. So I actually started with her at the very end of last year because I wanted to get some time in before she moved to Pennsylvania. So I started late in May with her last year, and then I did it throughout the summer. And by the time I had met my new mentor, I had already, gotten the hang of things, and it wasn't just my mentor that was teaching me things, it was everyone on the team that was teaching me things. And so one day in summer, before they switched over to the new Parkland, we had a bunch of time, so I just kind of interviewed a bunch of residents one day. So that's where I got most of my interviews from. They all told me about, the things that they do in their work life that I've seen, like getting vital signs, observing patients, diagnosing them, looking at their scans, assisting in surgery, seeing consults, that kind of thing. And they also told me how much it takes out of their personal life, and I thought that was really good to hear because I already knew them, so I could trust them to give me honest answers, and they were quite honest. So my first interview was with Dr. Ben Kafka. I actually did him and my next interview together at the same time. He's a second-year resident who went to Creighton University and Creighton Med School, and he told me a lot about how you can't always just go out like other people at night. You can't go, partying on Friday night because you might be on call. You have to really think about these things and maintain your health while you're keeping up with this stuff, so it's a huge commitment. And he also gave me some great college advice. He told me that I should major in either biology, chemistry, or biochemistry, because he said if you do that and you go into med school, you're much more prepared, after doing all those hours of science, rather than doing some other random topic, going into med school and being exposed to so many just science all the time. So that kind of also affected how I chose my major in college, because it made me want to major in science more, which I already wanted to do, but this sort of confirmed it. My next interview was with Dr. Chen Shi, along with Dr. Ben Kafka. He is actually an intern, so he's a first-year resident, and he was telling me how the interns kind of get stuck with doing the dirty work for the higher-up residents and the attendings, so they're the ones that answer all the consults and really take care of people. They don't really have the luxury of being in surgery all the time. Basic stuff like getting informed consent signed and, things like that, and they're on call much more often than people higher up. So basically, as you move up in your residency, you're on call less, so the interns kind of get the bottom of the barrel. And he went to the University of Illinois and NYU Med School, and he told me a lot about how you just need to test out the waters for different fields. like what I'm doing right now and see what you like and, set your mind to it. And if you choose neurosurgery, you need to be absolutely sure. So my next 2 interviews were at the same time also. The first one was with Dr. Bruno Flores, who's a 7th-year resident. He's one of the chief residents over at for Southwestern, and he's had a huge impact in my ISM experience. He's taught me so much. A lot of the surgeries that I had seen over the summer were led by him, teaching a younger resident. So watching him teach other people really taught me. And I thought his story was interesting because he actually did all of his schooling in Brazil, where he grew up. And over there, you don't have to do undergrad then med school. He just did medical school for 6 years, and then he came to the U.S. and did ER medicine for a few years, and he didn't like it anymore. So he came in and he did research for the university for a year, neurosurgery research, and then began his residency. And he told me a lot about how most people have stereotypes about brain surgeons that, neurosurgery is too hard to understand, and it is hard to understand, and that, people just have all these expectations going into it, and they don't want to even venture into looking at it because they think it's too complicated. And, it's really showed me that you really have to just try it out before you just stereotype it like that. So he was telling me, we love having students here. It's great if you bring other people in so they can see that it's not what people think, And he also told me the importance of keeping your home life and your work life separate. And so when I talked to him, I also talked to Dr. James Botros, and he's a 6-year resident. He's also a chief. He went to Boston University and WashU at St. Louis for med school. And he told me that, with this job, you do have to sacrifice a lot for your personal life because, you're constantly at the hospital, you're constantly on call. And he also talked about the importance of keeping your home and work life separate because, especially in a place like Dallas, you see a lot of depressing cases come in. People that don't have insurance, people that are homeless, or people that don't have anywhere to go, or they just have a bad case. So he said, they both said, if you go home and just think about all this stuff, you're just going to get depressed eventually. So they try to keep like a lighthearted atmosphere, when they work, and it's just a matter of, keeping your work and home life completely separate. And my second to last interview was with Dr. Tony Whitworth, who eventually became my mentor. He is the attending neurosurgeon, and he's now the chief at Parkland. He actually took Dr. Rickert's spot. He went to UC Berkeley and Tulane Med School, did his residency in Memphis and his fellowship in Portland. And he specialized in stereotactic and functional neurosurgery, which is basically neurosurgery for people that have conditions like Parkinson's or tremors or things like that. He has a lot of deep brain stimulation. And he told me that your number one priority has to be your job with this job because, you get calls in the middle of the night all the time. You're here early and you're working late. And my last interview, I don't have a picture for him, but it was with Dr. Vincent Ban, who is a neurosurgery researcher at the university currently. His story was interesting too. Bruno actually referred me to him. And he did all of his medical training in London. He grew up in Malaysia, but then he moved to London and did his schooling there. I think. Okay. And he was saying that he's currently studying for the board so he can apply for residency, but he's been doing research for quite some time at the university. And he told me a lot about things I had not even thought about concerning research. He told me that the purpose of research is not only to educate yourself, but it's to educate other people about things that were not already out there. So that kind of changed my perspective in terms of things I was researching for the class and what I want to do for my final product. And he suggested things for me to do. And I think after talking to him, I kind of decided that I want to do like a mock clinical trial for my final product because I don't have the means to initiate a real one because I'm not a brain surgeon or a grad student. So kind of in between interviews and research, we took a UNT trip for ISM. This is something that we do every year. It's an amazing field trip. You email professors and ask if you can sit in another class. So we go to 2 or 3 classes. So I had the opportunity to go to a neuroscience class first, which I absolutely loved. They were talking about taste and smell and hearing and sensory things, but it was interesting in ways that I hadn't thought of. I had never thought of how it connects to your brain, but this class really, showed me things that I had never even considered. And after that, I went with my friend to a speech-language pathology class because that's what she's studying. And that was actually interesting to me too because they were talking about how different parts of your mouth affect different noises that you make and sounds. And it kind of played into what I learned at the neuroscience class because, they were talking about taste and things like that. And the third class I went to was a biology class. And I noticed that I took AP biology last year. I noticed a lot of stuff they were talking about was things that I had already learned. It was like the same exact material, and they used the same pictures, so it was kind of easy for me to follow along with this class. So, as you can see, I have more than one mentor. Like I mentioned before, Dr. Whitworth is my formal mentor, but if I'm going to be honest, I probably have like 15 mentors at this point, because every single person on the team has contributed to my learning and my education, and they've all really just taken me under their wings. I'm at Parkland Hospital, which is this hospital right here. It just opened up, and that's Dr. Whitworth up here. And that's me and Dr. Rickert, and I'm blinking because I'm so bad at taking pictures, and I didn't know I blinked at the time. It's the only picture I have with her. But that's Dr. Flores and Dr. Botros, and then that's me with some of the residents. That's Ben, James, Chen, and then an ENT intern named Kathleen Kelly. And these are just all the residents, and I've met most of them. There's a few that I don't know yet because they haven't rotated to Parkland when I'm there, but it's not just the residents and attendings, it's also, the technicians. Jeremy White has been a huge mentor to me. He taught me how to tie surgical throw knots and suture, and, he really just was such a teacher. He was just like, let me just teach you all these things, and it was just so cool to get to interact with a field that I never thought I'd be able to interact with at this age. And, the nurses, like Lily, the scrub-nurse that's always in there, just the whole team really has just taken me under their wings, and I've learned so much in my time with them, and I'm so grateful to be there. So now I'm going to get into my research assessments that I did for the class. So the first assessment I did was over cervical myelopathy. I chose to do research on this because I actually saw a patient in clinic with Dr. Ben Kafka who had cervical myelopathy and kyphosis, which just means like he's a hunchback. But cervical myelopathy is a condition where it's a disorder of the spinal cord where the nerve signal is kind of interrupted, and it can affect other parts of your body. Like, it can cause like pain and weakness in your arms and your legs and loss of coordination. And I thought it was just so interesting because I was researching it and I was comparing it to the patient that I had seen in clinic, and it was all the same symptoms. They all matched up, because this guy said, Ben would go like this and he couldn't feel anything. He couldn't feel anything on his hands or his upper arm, his forearms, and, he was having trouble balancing himself, and he had pain in his arms and legs, and I just thought that was really interesting. I wasn't that into spine cases before, but learning about this really piqued my interest in that too. My next assessment was over Harvey-Cushing and Cushing syndrome. So this was actually brought on because my mentor had me write a 2-page biography over Harvey-Cushing and the disease that bears his name. And I never would have thought to research people, but it really changed things for me because he actually was one of the pioneers of modern neurosurgery. He changed the field in so many ways. He did so much research, and he discovered this condition called Cushing syndrome, where basically it's caused by if you're taking too many like glucocorticoid steroids, or if your pituitary gland is producing too much adrenocorticotropic steroids or cortisol. So that can lead to like central obesity or like a rounder, fuller face, slower growth in children, and skin irritation and bone thinning and bone pain and stuff like that. I just thought that was really interesting to learn about how one little thing going wrong can affect so much in your body. And my next assessment was over brain tumors, just because I wanted a general overview of them since I'd seen so many brain tumor surgeries, and I learned about 13 different types, and it was just a whole lot of information all at once. But it was really interesting. Brain tumors are basically caused when cancerous cells just keep dividing nonstop and they're out of control, and it causes cancer in your brain, or it can be caused by metastasis, which is cancer caused by a different cancer. So if the patient had breast cancer or lung cancer or colon cancer, oftentimes they'll get brain cancer also. Or other things like exposure to radiation, stuff like that. And my last assessment was over arteriovenous malformations, which you guys looked up. They're also known as AVMs. They're actually kind of similar to aneurysms. It's basically just when there's a tangle of blood clots, and if it were to rupture, all the blood would flow out of your brain just like an aneurysm. And it's kind of treated similarly also. They would clip it off or do some other thing, but they're really dangerous. And I've really enjoyed my research this year. I feel like it's been directed towards my topic much better than it was last year, and I feel like I've learned so much more about what I'm seeing by doing this research. So I'm going to leave you guys with another quote by Casey Neistat. He said, "With each success must come a newer and more ambitious goal. So this has really been a motivator for me because, last year I used this quote and it's just really motivated me to take things a step up this year and do things that I hadn't even bothered to try last year. So I encourage all of you guys to reach for more ambitious goals every time you achieve a new one. So thank you for listening.